During the last few weeks of your pregnancy, you may have a lot of concerns that you'll want to talk to somebody about. One of the major things that most women are thinking about is the birth itself and how they can prepare themselves for labour. Lots of women also want to include their partners in this so that they can be a good supportive birth partner. Looking for good antenatal classes is an important part of this, somewhere that you feel comfortable and will get the information that you need. Other things that you'll be concerned about in late pregnancy are how your baby's well-being is being monitored. It should be explained to you during your antenatal visits how you can make sure that your baby is doing well, and it should be discussed with you how to monitor your baby's movements, how to keep an eye on your own well-being, and who to contact if you have any concerns. Most fathers too are very concerned and interested in their partner's well-being and want to be involved in preparing for birth and being as helpful as they possibly can. They may come with you to your appointments, or you may arrange special sessions or antenatal classes just for them so that they can come and join in what's going to be happening and not be as frightened as they would be if they haven't had any preparation. One of the things that can help you to do this is getting a birth plan together. It's not essential to make a birth plan, as it's more of a guide for you to write down your thoughts and think about what you'd like to happen. But you do need to be aware that these things can change if labour doesn't go according to plan. They're just a guideline really on how you would like your birth to go. Getting advice on how to put that birth plan together again goes with having good information and help during pregnancy so that you can make informed choices. You've got the information to make the choices for the way that you want your birth to happen. There'll also be a lot of changes in your body in the last few weeks of pregnancy, and most women have some symptoms towards the end of pregnancy. Even if you felt really well all the way through, there tend to be things that go with those last few weeks of pregnancy that can make life a little bit more difficult for you. You may experience things like swelling in your ankles and sometimes in your fingers. You may find that you're not sleeping well because you have to get up and move very frequently during the night. You may find that you suffer from indigestion and heartburn, and that you're not able to eat very much at one time because the baby's pressing on your stomach. Some women also get varicose veins during the late part of pregnancy, which can be very uncomfortable. You need advice on what is safe to take in terms of medication and how you can manage these symptoms. Women are also very anxious to know when they should get help, what is normal and what is not, because pregnancy, particularly with your first baby, is not a normal state for you. Most women don't fully understand what is a normal symptom in pregnancy and what's something to be concerned about. You need advice on what to do if you have any kind of bleeding, what to do if your waters break. It's very common to feel sick again towards the end of pregnancy, even if you felt well during the middle part of it. If you have symptoms like headache, or you have visual disturbance, or you're feeling generally unwell, then that's the time to seek advice from your GP or midwife. Monitoring your baby's movement is important in pregnancy, and although you go for regular scans and hear the baby's heartbeat at your checkups, one of the most important ways of monitoring your baby's well-being is the number of movements that they make and how vigorous these movements are. In fact, it's one of the best ways of telling how well your baby is doing. Most women are very concerned about whether they'll recognise when labour has started. It's actually very difficult to miss when labour has properly started, but it's very easy to think that you are in labour when you're not. These symptoms are very easily confused with normal late pregnancy symptoms.